Well, I want to thank everybody for coming online today with us. This is Allie Orwig with the Indiana Rural Health Association. We do appreciate your time today. We've got Patty Rose with the Purdue Healthcare Advisors presenting a great bringing it all together kind of presentation for the last few things we've gone through with the Purdue Healthcare Advisors. And before we get to that, I would like to go over a couple little housekeeping things. We do ask that everybody who's not speaking mute their lines. If you're on your phone, you should be able to do that on the phone. If you come online, you should be able to do that by hovering at the bottom of the screen. The mute option should be in the lower left-hand corner. If you would like to ask a question during the presentation, we would prefer that you use the chat function. Again, you hover your mouse at the bottom of the screen. Some options should come up, and chat should be one of them. I'll keep my eye on those and act as moderator at the end of the presentation if we have any questions. And also, just for data keeping needs and for our ability to report on these free lunch and learns that we offer, we really would appreciate anybody that's on the phone or online just getting me what facility you're from, how many people are attending from your facility, and you can do that by emailing me at aorwig@indianarha.org. That, like I said, just helps us keep good records and helps when we go to apply to be able to provide these free presentations to everybody. So without further ado, I will go ahead and hand it over to Patty.
Thanks, Allie. Hi, everyone. Good afternoon, and thanks for joining today. Yes, as Allie said, I'm with Purdue Healthcare Advisors. I'm one of their managing advisors, and today we're going to be talking about quality resource use reports. It's basically a basic overview, and then how to access your QRURs. So just a few of the learning objectives that we'll review today. I'll briefly go over the value-based payment modifier. And of course, the quality resource use reports, or QRURs is how we refer to them. What is the QRUR, an overview of it, and then how to access your QRURs. And then of course, a question and answer at the end. So first off, our value-based modifier. Value modifier assesses both the quality of care, which is your PQRS reporting, and the cost of care, cost reporting, or claims that you submit to Medicare. Groups may be eligible for an upward, neutral, or downward payment adjustment via quality tiering. The value modifier is a per claim adjustment that is applied at the group level or your tax ID number. Payment adjustments varies by calendar year. This is just a little grid on how the value modifier works. So first off, you start with your PQRS reporting for the year. So right now, for PQRS, we're in a full calendar year of 2016. The information, you report this information to CMS, and along with CMS, calculated outcomes and cost measures are then analyzed. Each group receives 2 composite scores, a quality and cost composite. CMS classifies each score into high, average, or low based on the standard deviation, above, below, or at the national mean score or average. This identifies statistically significant outliers. Then CMS assigns groups to their respective quality and cost tiers to determine a positive, neutral, and negative adjustment to their payment based on performance. This is known as quality tiering analysis. And here, I love this grid. This is shows a relationship between the quality of care, your cost composites, and value modifier, or our quality tiering methodology. So as you can see here on the left, depending on where you're looking, the clinical care, patient experience, POP, community health, population, community health, patient safety, care coordination, and efficiency. Those are our 6 national quality standard domains that many of you may be familiar with in regards to the Meaningful Use Incentive Program. And then at the bottom, you have the total per capita costs and total per capita costs for beneficiaries with specific conditions. So you take those 6 NQSs and they go into the quality of care composite score. Then the bottom 2 per capita costs will go into the cost composite score. You take the quality and cost composite scores and they go into the value modifier. I know it looks easy and there is formulas on the background, but just in your mind, I think that helps to give a little a visual of how it all kind of fits together. So when did the value modifier take effect and to whom does it apply? I like this grid too. It shows you the first column, the years. This is the value modifier payment adjustment year. That's where the adjustment will take place. And then the second column is the value modifier performance period, or PQRS reporting period. So right now we are in 2016 performance year. The payment adjustment, or value modifier payment adjustment, won't take place until 2018, January 1st of 2018. And then the third column, required number of eligible providers per group. As you can see, it's progressed slowly. CMS is slowly implementing the value modifier. Right now for 2016, all providers are involved, and as you can see, all will be affected. So the value modifier will apply to the Medicare Shared Savings Program, or ACOs, Pioneer ACOs, and then the Comprehensive Primary Care Initiative. It's good to note that physicians who are not paid under the Medicare physician fee schedules will not be affected by the value modifier, and those are rural health clinics, FQHCs, or federally qualified health centers, and critical access hospitals using method 2. And then this grid, it's kind of busy, but I think it's a good pictorial of what's going on here. So you have your 2017 value modifier and then the 2015 PQRS. So 2017 value modifier for physicians in groups with 2 or more eligible providers and solo practitioners. You can see the PQRS reporters, there's 3 types: group, individual, and then solo practitioners. You have non-PQRS reporters, and if you don't report PQRS, you're going to get hit not only with a PQRS penalty, but also the value modifier penalty. So they go hand in hand. Mandatory quality tiering takes place. On the left, you can see physicians with 2 or more, or solo practitioners, upward or no value modifier adjustment based on quality tiering. And then physicians in groups with 10 or more, again, upward, no, or downward value modifier adjustment based on quality tiering. And this one is the 2017 value modifier payment adjustments. So in 2017, the value-based modifier adjustments, you can see, so if you meet PQRS satisfactorily, you will not get a value modifier adjustment or PQRS adjustment. But if you don't, then you're going to get a 2% penalty, like I mentioned, on top of possibly a 4% penalty for value modifier. CMS does do a performance resource risk adjustment per specialty, and this grid just kind of shows how that all applies. And on this one, the payment adjustment based on quality tiering for solos and groups, you have low cost, low quality, you're not going to get an adjustment. But if you have a high cost and high quality, there's no adjustment. That you do get a plus 2% for low cost, keeping costs down in your practice and then providing high quality. And this grid shows for groups of 10 or more, same concept, low cost, high quality, you're going to get an additional incentive for the value modifier of 4 times X, which is an adjustment that the CMS comes up with an algorithm or a formula that they come out. I believe it should come out in September sometime here. So to get down to what we're here to talk about today, what are QRURs? So your annual QRURs, which is good to note that we should be out the fall of 2016, which the QRUR would be 2015. They'll come out here hopefully in September sometime. These are comparative quality and cost information attributed to Medicare fee-for-service beneficiaries. The information that's provided in your QRUR tells you how your practice will fare under the value modifier program. I like to think of QRURs as a report card of sorts of your providers based on their peers across the country. The 2014, again, the 2014-2015 QRUR details how the value modifier policies will impact your group this year and then next year in 2017 that will be coming out soon based on the group's previous year's performance on cost and quality measures. So the QRURs that'll be out here soon will be from report performance year 2015. They will be made available to solo practitioners and groups of practitioners, including physicians, non-physicians, including those in ACOs and the CPC initiative, like I mentioned earlier. And then the QRURs that will be out here soon, they will also provide a preview on your performance on the value modifier based on your previous year's data. So what can you do with your QRUR for your organization? The QRUR provides comparative information about the quality of care furnished, your PQRS, and the cost of care to your Medicare fee-for-service patients. It also identifies gaps in care and opportunities to better coordinate care that can be used to improve your performance under the value modifier. These QRURs can help improve the quality and efficiency of the care that you deliver in your practice, and help you provide insight to the value defined by quality as a function of cost. So there really is great value in these QRURs. The QRUR contains the following sections. The first section of the report kind of gives you just a little bit about this report, an overview. Then there'll be a page on performance highlights. Then there'll be about the data in this report. Then they'll have a section on eligible professionals and attributed patients. There'll also be a quality performance section. They'll have information about admitting hospitals where your patients were admitted to in your area, cost performance data, and then per capita cost of services. So as you can see, there's a lot of valuable information in these QRURs. This is just a little snapshot of what the performance highlight page may look like in your QRUR. The first section usually has the quality composite score, then they have the cost composite score, and then this grid on the bottom, it's got all these little tiny blue dots all over, and then there's a red dot right in the middle. That will be where your practice would fall in this quality tiering. When we talk quality tiering, like the grids I showed you a couple slides back. So in this particular snapshot, or for this provider, they are falling in the average category. But you can see all the blue dots. There's some blue dots up in that high performance, low cost. Not many, but there are some. But for the most part, most practices fall in the average category. Ideally, you want to be in that low cost, high quality tier and the blue dot where you would get more money, quality incentive for good performance and low costs. And the next section on your QRUR, it has a high-risk bonus adjustment. This is an eligibility for a high-risk bonus adjustment. You would need to meet 4 criteria. You have your average beneficiary's risk would have to be above the 75th percentile, and then high overall performance, elected quality tiering, and satisfactorily reported PQRS via a GPRO or group web interface, which all ACOs report through a GPRO web interface, or GPRO registry, which is group registry. And then the risk adjustment. Older patients and patients with multiple health conditions require greater expenses. So thus, they are going to be risk adjusted. And this is an attempt to neutralize this area. And then this kind of is a snapshot. And again, all this information is downloaded. You can access these resources at CMS website. They have some really great information on how to interpret your QRURs. But again, this is just a little snapshot of what you're going to find. So on this page, within the QRUR, they're going to have this cover page, basically what, who, and how. Have performance highlights, shows your quality and cost composite scores, your performance for value modifier. Do you fall into the low quality, low cost, high quality tiers? And then they'll have various exhibits that reveal characteristics about your practice within the QRUR. I think they've changed for 2015 QRUR, that's going to be out soon. They no longer call them exhibits, but they will be annual QRUR tables. So that's something new. And in fact, CMS hasn't even come out with a guide on how to interpret your 2015 QRUR yet. So that is forthcoming. So back to see hospitals, one reporting section on your QRUR has information about your admitting hospitals, the cost performance, per capita cost per specific services, and then there'll be performance on risk adjusted measures. So again, a lot of great information. I highly recommend you access your QRURs. Last couple sections on the report, they'll have performance on cost measures, and then they'll have aggregate group level performance on the PQRS quality measures. And then also within a QRUR, these would have to be downloaded separately. There will be supplementary exhibits. These are really great exhibits, information that will be able to drill down. You'll be able to download those, and they can be exported into an Excel format where you can filter and the information you want to look at. Top of my head, I'm thinking diabetes patients. One of these exhibits, you can filter it out and look at all your diabetic patients that you treated in 2015 and see how you fare compared to your peers across the country. It's a good quality improvement tool to use it this way. Again, a lot of good stuff in these QRURs. And then I just want to touch base that CMS came out with a mid-year quality resource use report, or my QRUR. These come out normally in April. They are for informational purposes only, and it just provides a preview of the TIN's performance on the 6 cost measures and 3 quality outcomes measures that will be used to calculate the 2017 volume modifier, or previous year. So who are the QRURs available to? So if you're a solo practitioner or groups of physicians nationwide who bill Medicare Part B services under 110, you can access a My QRUR. You must have had at least one physician who billed for Medicare covered services during the performance period. Now, for the mid-year QRURs, performance period is July 1st of 2014 to June 30th of 2015. And they've also had to have had at least one quality or cost measure with at least one eligible case. How should I use my mid-year QRUR? The mid-year QRUR identifies opportunities to improve the quality and efficiency of the care your organization delivers. It gives you a better sense of your TIN's beneficiary population and use of the healthcare services that you provide. Also provides awareness of other providers involved in your patient's care. And then probably most importantly, how to gain access to your QRUR. How to gain access, you'll need to have one person from your organization will need to obtain an individual authorized access to computer services, or IACS. Well, as we all know, IACS is no more. In July of 2015, IACS was retired, and they now call it the EIDM, or Enterprise Identity Management System. EIDM provides a way for business partners to apply for, obtain approval, and receive a single user ID for accessing multiple CMS applications. What type of IACS or EIDM account roles are out there? You have groups of 2 or plus EPs. There is a PQRS group security official, primary or backup. With the PV stands for physician value, by the way. Physician value PQRS group representative, and then for individual practitioners or solo docs, you have PQRS individual primary backup, or the individual representative. So if the role descriptions, what role is best fit for me? So this kind of gives you a little breakdown of what role you would need for your EIDM account. So for group security official, or the primary or backup, you would want to register for PQRS GPro, obtain, this is what you could do if you were a group security official. You could register for GPro, you can obtain QRUR, and approve requests. For a group representative role, you can register for a PQRS GPro or obtain a QRUR. Individual role, obtain solo practitioner's QRUR and approve request. And then just an individual representative role, obtain QRUR. To apply for an EIDM account, you would want to go to New User Application Portal. And I provided the link at the bottom for you. A few tips when you are applying as an EIDM account. And if you can't remember if I have an EIDM account, you can always call there's a phone number I'll list at one of the bottom resource pages, QNet, and they can tell you if you have, or someone in your organization has an EIDM account. And if you Again, if you can't remember, just call them, and the number will be at the bottom or on the resource page. But some tips when applying for a new user ID name under EIDM, you want to ensure your address and name of the practice are the same as other documentation within your organization, tax ID, IRS, etc. You want to alert the security official to look for the approval of the account, which is sent via an email. Keep the account active by logging into the account once a month. Passwords need to be changed every 60 days, and inactive accounts often take days to reactivate. So if you're not sure, it's almost September, tomorrow, September 1st, I would definitely reach out and make sure that if you have one, if you can't remember your password, call the QNet support and they can help you out. And this gives a little bit of information that I just talked about, which are good to have. PTANs, which is the Provider Transaction Access Numbers. A lot of folks don't know what they are. They get on the line, they're filling out their application, and what's my PTAN? So that's a good added reminder. Find out what your PTAN number is before you apply. And then once you get an EIDM username and password, you can access your reports by going to portal.cms.gov. You log into the CMS Secure Portal with your EIDM, user ID, and password. And then once you're in the portal, you'll want to go to the PQRS tab. You select QRUR reports option from the drop-down. Then you'll have the opportunity to choose a year. You can go in there now and get 2014's data if you haven't already on your QRUR. You choose the year, choose the applicable option to complete your request. I plan to use this data in my capacity. There are always security steps that you have to take. And then once you get to your practice, you can go ahead and select the information that you want to download. So that being said, how can I prepare for the value-based modifier? Download your QRUR. A lot of good stuff in there. Like I said before, I highly recommend it. And then you want to identify when your practice and its physician will be impacted by the value-based payment modifier. Participate in PQRS. If you don't participate in PQRS, you're going to get double whammy. You're going to get a penalty from PQRS, 2%, and then a possible 4% penalty from the value modifier for not reporting PQRS. Obtain your quality resource use reports or QRURs. Again, a lot of good stuff, highly recommended. And this is kind of a little action plan for groups with 2 or more EPs. Last webinar I gave last week with Indiana Rural Health was on PQRS. So if you did not join us at that time, I believe the PQRS webinar will be on YouTube in a couple weeks. You can refer to that. But you want to choose a PQRS reporting mechanism and become familiar with measures and the data submission timeframes. If you haven't done that already, I highly recommend doing that. And then decide whether you want to report as a group. Well, unfortunately, this time has passed. You don't have to register to report PQRS as an individual, but if you wanted to report as a group, the deadline was June 30th. So just for next year, again, not sure what's going to happen next year. CMS likes to change the rules on us frequently. Number 3, download your QRUR and your mid-year QRUR. And then I haven't talked about this, but to review your quality measure benchmarks under your value modifier. CMS has out there, and I provided a link which would take you to where you can download your benchmarks. But benchmarks are just that. It just shows you where other people in the country are at on their benchmark data. This is a good tool to use as well as your QRUR. Access, download it, and use it. Obtain and review your supplementary exhibits in your QRUR. Develop a quality improvement plan and incorporate the information provided from your QRUR and supplementary exhibits or tables into that quality improvement plan. Use your QRUR and supplementary exhibits to identify opportunities for improvement and incorporate that into your quality improvement plan. If you feel the information in your QRUR is incorrect, you actually have 60 days from the date it's released to file an informal review. How to file an informal review? Again, I would reach out to the CMS website and they have all that good information there on how to do that if you feel that your value modifier is not correct. And then I provided a couple of links here on your resource page, how to access your QRUR, obtaining your physician value PQRS group security role. A lot of good information out there. Highly recommend to check it out. And then the PQRS G-Pro registration link. Again, unfortunately, that time has passed as of June 30th. And then here is the phone number. I mentioned the QualityNet Help Desk. If you can't remember what your EIDM username is and password, you can call them, or if you have one, just call the QualityNet Desk. In my past experience, the folks there have been very helpful. They usually go above and beyond. I've been very impressed with them. So great site. You can also email them. There's the QNet support email and the times that their offices are open. And so that being said, are there any questions at this time?
I haven't had any come in on the chat. If anybody has any questions they'd like to ask via phone, please feel free at this time. Okay, well, not hearing any. Patty has shared her contact information there on the screen. So if anyone has any questions after the presentation today or anytime, please do contact her. We will have this recording up on the YouTube channel, the Indiana Rural Health Association's YouTube channel, here in the next couple weeks or so. So Patty, we just really appreciate your time today. And again, if anybody has questions for Patty or myself, my email address is aorwig@indianarha.org. Please don't hesitate to reach out.
Great. Thanks, Allie. Have a great day.
You too.